Whenever we're ready, I can start the video and audio. Kindly see ya.
Yeah, maybe just give it one more minute.
Okay, sure.
One more minute. Okay, Arvind, want to start?
All right, cool. I
Yeah,
can.
can.
Cool. Okay. A minute. Okay, we're live.
We're live, huh?
Yep, I believe we're live. Yep, we're live.
Okay, thank you for all who have managed to join us today. It is very important forum, and today we have with us our comrade from Spain, Mr. Comrade Dick Nichols. Dick Nichols is actually the European correspondent for the Australian left paper Green Left Weekly, and he's been in Spain for many years now. So he'll be talking to us from Barcelona, Spain, on actually the situations there. Hi, Nick. How are you?
I'm very well, thanks, Silvarajan, and I'm very pleased to be with you. And
Okay.
greetings to all the comrades in the PSM.
Yes. And we have also together with us is Comrade Arvind, who will be helping us out here. Dick. Yeah, so Dick, so I think this whole COVID-19 things, even last week we had a comrade who was speaking from Italy, and we have seen how the situation is such a tragedy to see so much of deaths, so much of people unable to get medical health care and so on. So if I'm not mistaken, some of the latest figures are basically unbelievable what is happening in Spain today. From what I understand is that up to date in Spain itself, there's 152,400 over cases of COVID-19 in Spain. And the number of deaths are also astronomical. I mean, we can see that the deaths that I know of is that there's at least about 15,000 over deaths already in Spain. So this is really astonishing for us, especially for Malaysia, we being a developing country and so on. And we see these things happening in Europe. So maybe you can tell us and share with us, because what we know is that the first detected case in Spain was on 31st of January. And if I'm not mistaken, basically there was a spike in the number of cases beginning 16th of March. And then later on, we find that there was a state emergency, which was imposed on 14th of March. So actually, what is happening in Spain today? Why is there such large number of cases, infections, large number of deaths? So maybe you can tell us something, what is happening in Spain?
Well, I think the basic thing that happened is that the government completely underestimated the rate of infection of the population. I mean, there are estimates now of an infection of up to 7.5 million people being infected with the coronavirus or the COVID-19 virus. Many of those don't even show symptoms, but of course they contaminate, they propagate the virus in other parts of the population. Initially, the government felt that this was it was just an imported virus, and that they initially could just control the whole expansion of the virus by isolating any proven case brought in by tourists, isolating those, and then there would be no expansion of the virus. They would have that under control. So they said back at the end of January, there was a German tourist who was diagnosed with the virus. He was put in isolation. After 2 weeks, he was able to leave, and everybody felt this has been solved. Or basically, we have the method of solving this. But basically, what happened was that Spain being a place of high level of tourism, many people came into Spain without showing any symptoms or thinking they just had a minor cold or a minor complaint of that kind, and that actually then spread through the population. And suddenly we find the spike that you were talking about, which is what happened when the coronavirus started to affect. It was already there, and it was affecting the most vulnerable parts of the society and the people who are most vulnerable to being severely affected by the virus. And so this explains why here we have a very high death rate in old people's homes. That is to say, in aged residencies. In Catalonia, for example, we've had over 3,000 deaths. 1,000 of those have taken place in old people's homes. So people have visited their parents, their grandparents in old people's homes, not knowing they had the virus or not thinking that it was important, and yet it has turned out to be deadly. And that was the mechanism. At the same time, it should be said that the government was complacent about the central Spanish government was complacent about how they could control this. They didn't want to close down the economy totally. They didn't want to have a total lockdown and have everybody in the home. And that situation lasted for two weeks, while the medical experts, they didn't really want to hear the view of many of the epidemiologists who said you've got to have a complete lockdown. All non-essential activity has got to stop. And during that period, which was from mid-March to late March, the curve of it just kept going up and up. And so they were finally forced by the pressure from the regional governments, but also from their own expert committees, to impose a real lockdown. And that's what we're in at the moment. So I think that explains basically why we've had this such a disaster here. Another point worth making is that while Spain has good public health system, it's not a community-focused health system. It's focused on the patient. And so when you had a situation where the virus was spreading in the community, but was not being detected, in fact, the rate of detection was very, very low compared to the actual presence of the virus. And we still don't know. Of course, we still haven't done all the detection necessary. We don't know how widespread it is. Then the health system was very, very challenged to meet this situation. Not as bad as Italy, not as dreadful as Italy, but still very, very stressful. And that's it.
So what is interesting is your neighboring country, Spain's neighboring country, the UK, tried to do a herd immunity-based social distancing program that then resulted in a heightening of the infected and the death rates. Would you say that the Spanish government tried the same approach and then resorted to the lockdown, or what really happened? Was it just a complete underestimation?
So, I think it was an underestimation. We're not dealing here with the sort of, Trumpite Bolsonaro type response, which is really, well, so a proportion of the community dies, but we get herd immunity, to use that phrase. That was a temptation, of course, for the far right, for Trump, for Boris Johnson, until he actually became part of didn't have the immunity. But at a certain point, you can't run that policy and expect to be elected at the next election, which is what happened to Trump. You know, you say social Darwinism does not win you elections. Well, why do you have elections? You can only have elections, you can only have social Darwinism when you have got a complete dictatorship. Anyway, that's here that was different, because here we have a sort of centre-left government, which is a coalition of the PSOE, the Socialist Workers' Party, and the United, excuse me, United We Can, Unidas Podemos, and their response was what I described. As soon as they realised that this was a really huge threat, then they moved on it. They moved late, they moved in complicated ways, but they moved on it, and there was never any theory or never any thought that we could just ride this out and, you know, develop immunity.
Can't hear you, Siva.
Hello, can you hear me?
Yep.
Yes, I can hear you. Yeah.
Okay, yeah. We just like to ask a question. An additional one is that because we are seeing images here on how the hospitals were sort of overwhelmed, we find there's a lack of beds and this kind of images and news that we do get. Now, is it a situation whereby there was some failure within the healthcare systems over the years, or was it just because there's too much cases and they just got overwhelmed, the whole healthcare system? Was there any government planning before this, many years ago, that sort of like downsized public healthcare that caused this situation? Or do you think it's just a situation that overwhelming cases were coming in so quickly that there's no way that the public health sector could handle? What are your views on this?
I think there's a combination. I think that Italy shows even the best health care system which had done preventive work would have been very tested by this virus. But there are good examples. There are examples to the contrary, which were not, and the government was warned here about the possibility of a pandemic of this kind. The epidemiologists here were saying, look at what happened with SARS, with MERS, with the pandemics that were basically restricted to other parts of the world but never arrived in Europe. But the epidemiologists were saying, don't be complacent. Sooner or later, one of these viruses with a pandemic capacity will arrive in Europe, and you have to be prepared for that. And we've seen that in the Asian countries like, you know, Singapore, Malaysia, Vietnam, because they had the MERS experience, the SARS experience, they had a system in place to detect the cases of infection and isolate them and treat them. That wasn't the case here, and nor in Italy. So that was that we will now see that will now definitely be the case, that they will rework the whole public health system to meet that need. That is, I think, is definite. On the other hand, another thing that needs to be said, though, which is that because we have a good basic public health system here, despite a rundown in financing and despite sort of creeping privatisation at the edges, there was an enormous response by the health professionals here, by the workers, by doctors and the nurses, which meant, for example, in Catalonia, there was an expansion, a threefold expansion of intensive care units to meet people who had dreadful trouble with breathing, needed to be on respirators or ventilators, and it would seem that has been done enough. That capacity will be enough. We don't want to be complacent, but in the United States, to make the comparison, this is going to be an absolute disaster because the capacity doesn't exist, and so I would say the policies of privatisation and cuts in funding to health made the thing worse. It would have been handled better if there had not been these cuts, obviously. The complacency about, oh, well, we haven't not preparing for such a possibility, as has happened as has been prepared in countries in Asia, contributed. But really, the big problem was it was so massive. The thing came so massively, and it was not detected. If there'd been a detection system, a better detection system, obviously, the final result would have been less disastrous. That's it.
Yeah. I'd like to also ask that what we read some reports, there are certain locations or certain provinces, if I'm mistaken, that have seen a great number of cases, that means in terms of cases, in terms of deaths, if I'm mistaken, like areas like Castilla, Catalonia, Madrid especially. Why is this so? Is it basically because of the density, the population, you find such high cases? What do you think?
The full story about the way the pandemic spread in Spain, we still don't know. But I think the feasible story is this. The centres for the most contamination were the tourist centres, where there's most tourism. So that's tourism into Madrid, tourism into Barcelona. That's definitely the case. Then we had other factors, which I've referred to, which was because the lockdown was not 100% in the first 2 weeks. What happened was that people with second homes, the richer parts of the community, especially from the northern suburbs of Madrid, they just drove off to their second homes to pass the weekend in mid-March, in the third week of March. They went down to the Mediterranean coast, or they went up to the ski resorts in the Pyrenees. The same thing happened here from Barcelona. They went up to the coast. And what this did was it spread the virus to other parts, but to other places where there's high levels of tourism and second homes. But though, interestingly enough, the parts of Spain where there is lower levels of tourism, poorer parts of Spain, and where there was a higher level of detection, they're the ones where the rate of infection is less. And the third example I would say is that of the Balearic Islands. The Spanish government decided that it was not going to implement, or it resisted implementing a full lockdown for 2 weeks, as I've said. One of the reasons it did that was because the regional government leading the lobbying for a full lockdown was the Catalan government. And of course that touches on all the most sensitive question in the Spanish state, which is the Catalan movement for independence and self-determination. So there was no way the Spanish government was going to accept pressure from the Catalan government by itself. It was only when other centres joined the Catalan case, joined the Catalans and said, no, we have to have a full lockdown, that it actually came about. But the example I want to give is that after they'd rejected having a full lockdown in Catalonia, which was also asked for by the Catalan government, they accepted a full lockdown in the Balearic Islands, which are the islands to the south in the Mediterranean, Mallorca, Menorca, Ibiza, Formentera. And they had a lockdown from earlier than the rest of the state. And in that lockdown, the lockdown was absolute. That is to say, there was one flight of aircraft a day into those 4 islands. There was one ferry a day into those islands, and everybody was tested. And anybody who was found to carry the virus was put into isolation. And the result of that is now visible. There's now a markedly less rate of contamination, of infection in the Balearic Islands. So yes, this explains the uneven distribution of the infection across the Spanish state. And it's related to what I said about the old people's homes, because once the virus got concentrated in particular regions or in particular residences, it's so contagious that it just goes everywhere.
At this juncture, there's a question from one of our audience members. Unfortunately, we've seen a lot of racial attacks, especially towards quote-unquote communist China, with all the conspiracy theories saying that it's an engineered virus and all of that. Is this the case in Spain as well? Is there a lot of conspiracy theory racial attacks?
No, no, there's not. There's not, because, as I said, Spain is a strange place. The Chinese, there's a big Chinese community, and in the Chinese commercial community, in especially in Barcelona. Um, and a lot of the Chinese firms thought it was wiser to close down, to have a holiday while this is going on. But there's been no racial, uh, with one exception, which I'll talk about, there's been no attempt to blame the Chinese or call this a Chinese disease a la Trump. What we have here is the Vox, which is the extreme right racist party, which we have in Spain, equivalent to the National Front in France, or other formations like that, or the Lega Nord in Italy. They tried to start a campaign against the Chinese, a sort of Trump-style campaign, but it fell completely flat. Because there's no sensation, there's no sense here of racial discrimination against the Chinese. Some people will have racist attitudes towards Chinese people, but it's no general sentiment like that. If it had been the North Africans, the Moors, that would have been better. It would have been better. And then we could blame the Moors. We would prefer to blame the Basques or the Catalans or each other before we blame anyone else.
It's quite surprising, but also kind of heartwarming at the same time. So let's move forward from healthcare scares and go into another critical part, which is employment. So before COVID, if I'm not mistaken, the unemployment in Spain was already at quite a high percentage, about 14%, if I'm not mistaken. Have those estimates gone drastically higher, as we've seen in America?
Yes, they will do. I just sort of explained something. 14% is a high unemployment rate in other countries, but 14% is regarded as a low unemployment rate here. So because the base unemployment rate is much lower in Spain, it's much higher in Spain, I should say, historically and structurally, than in other countries in Europe, with the exception of Greece, and certainly with countries in Asia, or Malaysia, for example. What has happened is very like what has happened in the States. The latest statistics, which I just looked at this morning, the unemployment rate was 13.6% in February. Just 1 month later, it's gone up to 14.8 or 14.9%. But more important than that is that a mass of workers, 1.84 million workers, have been stood down. And they're being paid by the government. They're not being sacked, but they have stood down, and they are being paid a basic survival payment. And which will of course depend on the way the crisis goes, then the unemployment rate will be quickly up to 20%. 25%, even 25%. So that is the pressure on the government. The massive political pressure on the government is to make sure that doesn't happen.
Okay.
Building up.
Yeah, go ahead, Arvind. No, it's okay. Go ahead.
No, I was just wondering, building up on that, has there been any push towards more government jobs? Scheme?
What it has done, it's released an emergency package of support for the poorest parts of the population. And this emergency package, am I clear? Am I coming through?
Okay.
Yes, can you
Yes,
hear me?
you are. Yeah.
Okay, good. For a moment, I thought I wasn't coming through. So there's an emergency package which is very targeted. It's got all sorts of conditions to it. But this is the government is not yet thinking about actual fiscal measures that would be, these are income measures. They're not thinking about investment measures to try and absorb the coming wave of unemployment. They will have to do that. And the European Union as a whole will have to do that, because going on even the most conservative estimations, there's going to be a huge spike in unemployment. I mean, reputable economists, people who tend to be conservative about these, are predicting unemployment rates of up to 18% across the industrial world. So there will be no quick recovery from that. So the necessity for fiscal measures for sort of employment, the government investing to create work, especially when there's a whole lot of work that needs to be done, especially in the area of green transition, that will come up. That will come onto the political agenda very rapidly, I would think.
Yeah. So just continue from there, like what you're saying, continue from where you're saying now regarding the unemployment and also the looming recession that we think is going to be a worldwide thing. It's very interesting to see that Spain will be the first country to introduce the universal basic income. Now, we had some discussions even in other places, even here in Malaysia. So it'll be quite interesting to see how that's going to be working out and how it's actually being implemented in Spain. So maybe you can tell us something about that on the universal basic income in Spain itself.
The guaranteed minimum income here was a condition for the alliance between the PSOE, the Socialist Workers' Party, the government, the majority partner, and Unidas Podemos, the minority partner to its left. And the reason for that is the guaranteed minimum income has got a lot of support in Spain. That is to say that the left as a whole has accepted the idea of guaranteed minimum income. And one of the reasons for that is we have a very corrupt ruling class, very corrupt rich. The country is, these are people who don't pay any tax at all. And the taxation rate, the average taxation rate of all tax income in Spain is 7 percentage points of gross domestic product less than in the European average. And this is all due to tax evasion by the rich. This produced this reaction in favour of guaranteed minimum income for the poor, also because of the dreadful effect of the 2008-10 financial crisis here. So as I say, guaranteed minimum income is a popular thing here. The government then has come out. It was accepted as the basis, as part of the platform for the government. It was then announced that they will be working towards the plans for this. Now, the actual how this will work, we do not yet know. It is to say what the conditionalities are. Is it going to be really universal? Are there going to be exemptions? All of this is still to be decided. I should say that there's a guaranteed minimum incomes operating regionally in Spain, in the Basque Country and in Catalonia, but they are very, very restricted. And basically what they are is a sort of a thing called the guaranteed minimum income, but they're a welfare payment to the poorest of the poor. So basically when you have the poorest of the poor who aren't able to get unemployment benefits, if unemployment benefits cut out here after 6 months, then we have this special payment, which we're calling a guaranteed minimum income, but it's not a guaranteed minimum income in the sense that the exponents of the guaranteed minimum income really mean. So that's coming. That's been promised. In the meantime, they've come out with, I think I've already mentioned, an emergency bridge package, which will be in place until the guaranteed minimum income is actually introduced. So they've introduced this bridge package, which was only announced a couple of days ago, which is designed to support the 3 or 4 million people who are not part of the social security system formally, because we have a social security system which is contributory. You pay a third, you're a worker, you pay a third, the employer pays a third, the government pays a third. But there are many people who are not informal.
Comrade, sorry, we can't hear you. Your microphone's off.
Sorry, it just cut. Did I just cut out? Did I?
Yeah.
Yeah.
Could you just tell me where I got to? I was talking about there are many people who are not covered by the social security system, about 3 or 4 million.
Yep.
So
Yes.
this and these are the poorest people and the people in the worst jobs and the most casual jobs. I mean, we're talking about um, migrant women from Latin American countries who work in the hotels. The whole hotel system in Spain would collapse if there were not women from Latin America working to clean and maintain the hotels. Um, some of these women are in the social security system, but a lot of them are not. You have self-employed people who, in order to get by, decide not to pay a contribution, so they don't officially register as unemployed. Anyway, this package is designed to do that, and I haven't had time to study it, but that is that's a step forward. It's definitely a step forward. We've had other parts of the package of income support which are still being contested here by, for example, rent. Should there be rent payments be suspended? Mortgage payments have been suspended, but the vast majority of people here are not buying a home. They like everywhere in the world, they pay landlords, and the movement, the rent defence movement. There's a union of people who rent. They're demanding that there be a suspension of rent. But this is a complicated thing because a lot of the people you are paying rent to are not. This is their only source of income. This is the older. This is not some big, vulture fund. It's somebody who managed to save up to get a little house, and it's the way they're staying. They're getting an income in their old age, so they're trying to address that problem at the moment.
Cool. Right. So I just want to ask because the other day I was reading this article about gun manufacturers making a lot more money now because a lot of people are actually buying more ammunition and guns in America, especially. Yeah, I know. I was disgusted as well. So, do you have anything to comment on this trend, or is it happening in Spain at all?
No, nothing. Spain is the United States is a completely different universe. Here, the only people who support guns being available to the population is the Vox, the far right, and that's not winning them any votes. They're not going to win many votes on the basis of we want to have guns. In fact, it's a big joke here that Vox wants to confront the coronavirus with guns. Well, that's going to work. Spain has got this. Of course, the whole tradition here is determined by people's attitude towards guns. Is determined by one big fact, which is the Civil War. So there's a horror of violence. There's a horror of war. Spain is one of the countries where you've had the biggest demonstrations against the Iraq War, for example. So there's nothing like kind of the American craze for gun ownership. Nothing like it at all.
Yes, Arvind, you have a question?
No, Siva. Do you at the moment?
Okay. Yeah. So, I think just now we were talking about workers and what kind of packages or what kind of assistance the government might be giving. Now, is there a situation? Is there another assistance program or the government is planning for the urban poor, basically the bottom 40%, the homeless people? Is there something which is happening now? The government is thinking about it, and how are they being handled in this current outbreak?
That program, which I just mentioned, this emergency bridging program, is basically directed at the urban poor. As I said, I'm not in a condition to say how good this program is or how tight it is or stingy it is. certainly it's needed, but we'll only be able to see in a week or so how much, how real this is. There's a lot of complaint at the moment that a lot has been announced, and there's all these things coming, but we haven't seen them yet. So if in a month's time, we'll be able to answer that question. There will be a lot of peril. There'll be a lot of poor people who will not be able to be supported, because Spain is not an organised, and is not a perfectly organised country. Quite the reverse. Well, I'll just give you some examples. This gives you an idea of how the place works. There has been a lot of migration into Spain from young people in North Africa, Morocco in particular, looking for a better future in Europe. A lot of these people are illegal immigrants. So they either get locked up in detention centres, or they are taken into sort of homes for the underaged. What has the government done? They've done one good thing, which is they've released all asylum seekers have been released from these detention centres. And the reason they've had to release asylum seekers from the detention centres was that they didn't want to have places where there could be a concentration of the virus, a rapid expansion of the virus. And anyway, these people, these mainly young people, all had some place to go. They had the place to go where they were arrested for being illegal immigrants. So they just went back to where they had been arrested. So that was a good thing. And in Portugal, they have an even better policy. In Portugal, they said, we just declare everybody who is, quotes, illegal or seeking asylum to have full citizenship rights for the extent of the crisis. So they've actually eliminated the idea of illegal people in Portugal, and that's a very important thing. It's not the same here, but what this means is that you've got a lot of these people have been able to go to a home, but then you've got a layer of young people who have got nowhere to go. So, but then the government has a problem, because the harvest season is coming. And if you have a lockdown, and the harvest is very important in Spain, because you've got all the wine production, you have all the fruit production, this is a major agricultural exports. Where are we going to get the workforce from? So they decided that these marginalised young people who are illegal, there's a good workforce, we'll give them the opportunity to do fruit picking and picking grapes. So these people, from being a burden on the community, in inverted commas, have suddenly become essential, and they've been legalised. So they'll be able to, take part in the fruit picking and the grape picking season, which starts here in about 3 or 4 weeks. We make the point here that this crisis has good sides, because it shows, one, what could be done if you had planning determined by social need, and two, it shows that there's no national solution to this thing. You can't say, you can say it in Australia, only Australians are going to be helped, but here you can't do that.
Yes, yeah. I think one more thing that I think our comrades would like to know about is that, because here what has happened in Malaysia is that once there was a lockdown and businesses were asked to close, I'd like to know what was the response from the businesses, either the big companies or even the small and medium enterprises, because here was a big cry from them. As soon as they were asked to go on a lockdown for 2 weeks, immediately they say they're going to go bankrupt. They say they're not going to pay wages, even though no one asked them when they're making millions of money. But even like big companies, even the hotel sector, just after 2 months, they say that no, we are unable to pay any more wages. We cannot sustain. We're going to close shop, and they were crying out for these bailouts from the government. So, what was actually the response of businesses in Spain? Would they able to sustain themselves, or would they sort of like really going out and seeking government assistance? What was the situation there?
Well, you've got a lot of kicking and screaming and yelling from big capital in particular. But with some nuances, because some parts of big capital here, which is extremely unpopular, because for the reasons I explained about they don't pay any tax, you know. So there's a big sentiment of popular resentment towards the really big capital. They saw in this an opportunity to present themselves as heroes, as you know, leading the fight against the coronavirus. So, for example, in Barcelona, and I think in Madrid, these big hotel chains made their hotels available for recovering patients. So we have patients recovering from infections who have come out of a critical phase, who are being housed in the most posh hotels in Barcelona, which they deserve to be, you know, and the hotels have been medicalized and they're looked after there. So there's been a big attempt to use this crisis by some sections of big capital to show how community-minded and how social-minded they are, right? But on the other hand, there's another thing that I should mention is, of course, there are not enough respirators here, not enough ventilators. And suddenly there's a huge demand for ventilators around the world. The United States gets in there and offers more money than anybody else for existing ventilators. A black market develops. So here what happened was that engineers in big companies that had stopped working, particularly car manufacturers, went and said, we'll develop ventilators. We'll develop respirators, and we've already had 4 new models of respirator developed in the space of three weeks here in Catalonia, and one of those has already been certified by the Spanish Ministry of Health as meeting requirements, meeting criteria. That is, of course, not big capital, but it's big capital didn't say to its engineers, no, you can't do that. The engineers said, look, there's a crisis. We can turn out these things. We can design these things. This is not, rocket science. And so that's a good sign. Other parts of big capital, of course, putting the pressure on the government. No, we don't want to pay taxes, a tax holiday, etc., etc., etc. And also some changes to the labour market legislation. They will continue to put the pressure on the government. The government that pressure operates as a permanent pressure to get the total lockdown lifted as quickly as possible. But they can't do that, having said how serious the crisis is and people having experienced how serious the crisis is. For small business, and small and medium business, there's a rescue package. And a support package. And again, as I said, for support to workers and the poor, we're yet to see how effective this is. But there's a sizable package that's been brought out. The only problem is here, I would say, not the only problem, but a big problem I see here, being Spain, everything is more bureaucratic than it needs to be. So the government decree on how they were going to support people during the crisis was a 66-page decree, and then people read it and they found all these mistakes in it, and then they had to clarify it with a 98-page decree. So there's 150 pages of paper which describing what you can and can't get. Compare that to Denmark. Denmark, they just did a deal with the employers and the unions. They had only 2 pieces of two decrees, and they've got the whole thing covered. With the employers, they said, you pay 75% of the wage while this goes on. No, we'll pay 75% of the wage while this goes on. You pay 25% of the wage. Okay, we agree on that. And with small and medium business, they came out with a comprehensive package of tax relief, blah, 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 suspension of payments, etc. And they went up 5% in the polls as a result of that, the government. Here it's been the reverse. They've gone down 14% in the polls.
Oof. Yeah, so that's the domestic reaction towards the virus. We were talking earlier about the European Union and what they have done recently. I was wondering if you had read through and if you have anything to comment on how the impact of the European Union's plan will affect the member states. Or do they have a plan?
that's that. Well, the big package. First of all, the immediate response or the immediate reaction of all the big units of the European system, which is the European Central Bank, was to not want to really deal out a lot of money. So when Christine Lagarde, the head of the central bank, said, we're not in the business of reducing spreads on state debt, which immediately produced a huge collapse in the stock markets in Europe. So she had to reverse that. And then the European Central Bank came out with 750 billion in excess liquidity, in more liquidity, 750 billion. But such is the nature of this crisis that you just can't solve it or contain it by monetary policy of that kind or special monetary policy of that kind. And there was always pressure from the south, from the southern countries, for a big budget package from the European Union, and in particular that there would been able to be a European debt, which has always been opposed by Germany and the North. That is to say, European debt, European bonds, call them COVID bonds, call them coronavirus bonds, doesn't matter. So the first meeting of the Eurogroup, which is the meeting of European finance ministers, could not reach agreement on this. This was just last week. And basically the resistance comes from the surplus countries, but in particular from the Scandinavian countries, but also from Holland, who leads this, who leads this charge. But such was the response here and amongst the southern countries and in the countries to the eastern part of the European Union. They said, basically, if the European Union as a union can't mobilize funds for a crisis like this and act as a union to do that, what is the point of it? This is a critical test. This is a life and death test of the European Union. And finally, just yesterday, your time, the Germans decided that there had to be a big fund, and it's a $500 billion fund to help meet the crisis, make unemployment payments, do emergency and medium-term investments, etc., etc. As I say, this is still early to see whether 500 billion is enough, given what the effect on the world economy of the crisis will be in the United States. But it's certainly much more than what the Dutch government was prepared to pay. Their initial response to this was what happened with Greece in 2008. The problem is these Greeks, they just spend money, they get into debt, and then they want us to bail them out. In the south, that's what the southern countries are like. So you get the sort of prejudice towards the countries of the Mediterranean South. There was a touch of that from the Dutch, or more than a touch of that, but so deep is the crisis that they've come out with this package. But whether this package is enough will be something still to be worked out.
Right.
Yeah. Okay. Yes, Arvind, go ahead.
Yes, we have a question from one of our viewers again. I think both PSM and yourself being socialists, we have followed the campaign of Bernie Sanders from when he campaigned to be president and then when he changed to combat the coronavirus. And now he's out of the picture of being running for president. The question is basically, is there anything to learn from his campaign, and would there be some advantage to socialist parties in Europe and other parts of the world to learn from the steps taken by and the things fought for by Bernie Sanders in his campaign?
Well, that's a big question. I think this is just a personal opinion, and this is not related to directly to the question of the coronavirus, but I think the Bernie Sanders campaign was something very American. That is to say, here we had a country where you've had two bourgeois parties for 100 years, And every now and then you get a third party that comes up, which is more progressive, but, and there's a history of these third parties in the United States. But the whole establishment rises up against the possibility of there being a socialist party or even a social democratic or Labor Party type alternative being presented in the United States. Bernie Sanders' campaign was the biggest threat to two-party bourgeois politics, call it that, in the United States ever since the 1920s, since Eugene Debs' socialist campaigns when he ran as president from the jail. He had his famous badge, vote for prisoner number 93641 or whatever it was. That was the biggest campaign, the biggest, pro-worker, pro-people campaign and threat to the two-party bourgeois politics in the United States ever. Here, of course, it's different because there's always been socialist parties here. The problem here is, of course, these socialist parties have degenerated. The Socialist Workers' Party of Spain is a classic example of that. It began as a revolutionary party led by the original Pablo Iglesias. It was a Marxist party, clearly defined itself as a Marxist party, was regarded as the threat by, an enormous threat by the ruling elites here. Basically, one of the reasons you had the Franco dictatorship, or you had the dictatorship in the 20s, and the Franco dictatorship from the 30s till the 70s, was the threat represented by the working class movement and the working class parties. Whether that was a real threat or not is, of course, a continuing debate and discussion. But that's completely different from the United States. So I don't think there's an immediate lesson from Bernie Sanders' campaign that passes across here to continental Europe. But having said that straight away, there is a lesson, which is that you need to have a serious, popular, mobilizing campaign around things that matter to people is absolutely critical. And here we have a very disappointing experience of Podemos was potentially that. But Podemos leadership accepted the idea or supported the idea that the best thing they could do was become a minor partner to the PSOE. And this has created a situation here where the major opposition to what this government does will come from the right. So it opens up the possibility that we'll get a right-wing government, and not just any sort of right-wing government, but a very horrible right-wing government, which is conditioned by, fascists, which is Vox, neo-Francoists, fascists. So just saying these things in answer to your question shows how different politics is, mass politics is in Europe as opposed to the United States, precisely because you've had mass working class parties here.
Okay, Dick, maybe we would like to end this session at the moment with to get some final words from you. I think this whole COVID era, this whole this tragedy that this whole world is going through has made us to sort of rethink, especially for left, especially for the socialists, on what are the important things that I think we can put forward. Because here in Malaysia also we're thinking that I think it's about time that we should recalibrate the economy itself. Now, this COVID incident has proven that how the neoliberal system has failed us, how the capitalist economy has failed us. So it's, I think, very important that people are able to see, the masses are able to see when all the healthcare system, the public healthcare system fails them. So I think it's a very crucial time for us to put forward concrete ideas on how government should recalibrate the economy. And so maybe we would like to hear from you that in terms of healthcare, in terms of urban poor, in terms of reducing the inequality gap, what are the strong, concrete points that you think that socialists throughout the world should put forward at this very critical times?
Well, I think the situation. I agree with your statement. This is a real test for us. This is a test for the left and the test for the socialist movement. Are we up to the challenge? Because you've got millions of people who are just horrified and disoriented and looking for an alternative. And they know that this COVID-19 it's not going to be the last time. there's no. It's not just going to be one COVID-19 and then that's gone and then life goes back to normal. Here in just again in Spain, there's quite a strong sentiment that things have got to change radically. But what does that mean? How do you mean change radically? What has to change? Because the right wing has its answer, which is they feel more confirmed in their politics. That is to say, keep out the foreigners, have an authoritarian state, etc., etc. That's the right wing feels confirmed by that and is already using it here as saying, well, how are we going to confront this stuff? We've got to do it with a stronger state, etc., more repression, all their usual recipe. I think for the left, and speaking here from Spain, there'd be three things I would want to stress. One is public health, which has to be community-based. And I think it's going to be very hard for the right wing to reject this. I think even right-wing governments are going to have to accept that proper funding of public health and an end to privatisation of public health and a restructuring of public health as preventive medicine based in the community and as a community service and not just as, treating patients individually. There's big support for that, and the left should go very strongly on that. The second thing I think is the connection between the public health aspect of the crisis and the environmental and sustainability aspect of the crisis. Here, more and more people understand why have we suddenly got these pandemics? We've got these pandemics because human civilization, call it civilization or capitalist production, is pressing more and more on the natural environment. It's inevitable that viruses that are natural and harmless in animals will mutate, pass across into the human population with these sort of consequences, these tremendous consequences. How do you stop that? Well, you're facing a production mechanism which is in expansion, needs to expand to make profit. It has to be expand. And that's why you get, a Bolsonaro in Brazil saying, well, we can wipe out, another quarter of the Amazon because we need to produce, etc., etc., etc. We have palm oil production in Indonesia, for example closer to yourselves. So the whole question of a Green New Deal is connected to this. And I think left forces have got to lead on this idea of a Green New Deal, whether you call it a Green New Deal, but it has to be a transitional program to sustainability, which is also a transitional program for social justice. That's a nice general phrase, but to make that concrete in any particular country is a real job for the left, and to popularize it. So it's not just a phrase in the air, but it's people say, yes, that's what we want. And I think they're the two things, and they're the two main things. And the third thing I would stress is that more than ever, internationalism. More than ever, none of this stuff can be solved in the national framework, and the old left perspective, the old socialist perspective, becomes more relevant than ever. That is to say, more collaboration, more solidarity between peoples, and that whole thing. So that's what strikes me, having lived through this thing in Spain for the last month or so. That feels to me like the main messages coming out of it.
Okay, thanks very much, Dick, for sharing those important points and insights. So I think that this whole thing, this challenge that mankind is now facing, or humankind is now facing, it has sort of given us an opportunity to sit back and look at actually what is happening, and more importantly, for the left to put forward correct perspectives. Because I think, as far as the bourgeoisie, the normal political parties are concerned, they're just waiting to get back into business as usual. So I think it's very important for us to remind people what has happened and what should not happen. It should never be, again, business as usual. And hopefully we will be able to put forward some clear demands and clear struggles after this. And so thank you very much for sharing. We hope that all of us can overcome this great challenge that you're facing, and you can come out much more stronger. And so we hope that everything will be much better in Spain, and we hopefully here in Malaysia things will turn out to be better. It was just announced today by the Prime Minister in Malaysia that they have extended the movement restriction order for another 2 weeks. So we unfortunately are sitting at home for another 2 weeks now. So May is a big problem this year. No rallies this year, unfortunately.
Yeah.
Okay.
Well, we will adapt to that. Thank you. I just want to say thank you very much for the invitation, because I really appreciate being able to talk to you, comrades, from such a long way away, but it's not such a long way away.
Okay, please send our solidarity to all the comrades back in Spain. We hope they will swing through this challenge. And also thank you, Arvind, for helping us out, and maybe we'll meet again for further discussion after this.
Sure.
Thank you very much.
Thank you.
Thanks a lot.